Hey there, future health millionaires. Welcome to Health for Millionaires, the channel where we invest in the ultimate currency, your well-being. I'm Dr. Nius, and today, we're diving into a topic that could save your life or the life of someone you love. Think of this as your VIP health alert, because even millionaires can't buy back time when it comes to cancer. Whether you're 20 or 60, these red flags don't care about your bank account. So grab a pen, smash that subscribe button, and let's uncover the clues your body might be sending you right now. This isn't just a video, it's a lifeline. Stick around, your health portfolio is about to level up. Let's get started. Did you know that early cancer detection can boost survival rates by up to 90%? Yet, many people dismiss subtle warning signs, mistaking them for everyday ailments. That's why today, we're uncovering 10 early signs of cancer you absolutely shouldn't ignore, equipping you with the knowledge to act swiftly and confidently. We're not here to scare you, but to prepare you. Remember, early detection is your best defense, and being informed is your greatest strength. Let's dive in and empower your health journey. Unexplained weight loss. First up, unexplained weight loss. We're not talking about shedding a few pounds from a new diet or exercise routine. We mean losing 5 kilograms or more over a relatively short period, a few weeks to a few months, without any intentional effort to change your eating habits or activity level. This isn't a reason to celebrate. It's a significant warning sign that something may be amiss and is often associated with cancers like stomach, pancreatic, lung, or esophageal cancers. Cancer cells are incredibly demanding. They hijack your body's nutrients to fuel their rapid growth and proliferation, drastically accelerating your metabolism. In addition, some tumors may release substances called cytokines, which can actively break down fat and muscle tissue, leading to rapid and unintentional weight loss. Be vigilant about tracking your weight. A simple way to do this is to weigh yourself once a week and record the results. If you notice a sudden and persistent drop, especially if it's accompanied by other symptoms, don't delay. Request a comprehensive checkup from your doctor. This should include blood tests to assess your overall health, including a check for anemia and inflammatory markers, and imaging studies like a CT scan or ultrasound to visualize your internal organs and identify any potential abnormalities. Don't wait and see. Act and know. Persistent fatigue. Feeling constantly wiped out despite getting adequate rest, proper nutrition, and managing stress effectively? We're talking about persistent fatigue that goes beyond ordinary tiredness or the occasional slump. This type of fatigue, often linked to cancers like leukemia, lymphoma, or colon cancer, is often paired with anemia, a deficiency of red blood cells, resulting from internal bleeding, the cancer's effects on bone marrow, or your immune system working overtime to combat cancerous cells. In leukemia, fatigue stems from an overproduction of abnormal white blood cells that overcrowd the bone marrow, hindering the production of healthy red blood cells. This leads to anemia, starving vital organs of oxygen and essential nutrients and causing profound fatigue. Request a CBC, or complete blood count, from your healthcare provider. This simple blood test can check for anemia, reveal any abnormal blood cells, which could indicate leukemia or lymphoma, and assess the levels of various blood components, giving you a clearer picture of what's happening inside your body. If the CBC is abnormal, further testing, such as a bone marrow biopsy, may be needed. Don't dismiss persistent, debilitating fatigue. Get it checked, and get answers. Unexplained pain. Persistent pain, such as deep bone aches, persistent headaches that simply won't respond to over-the-counter medication, or abdominal pain that doesn't subside, can be a concerning signal. This type of pain can indicate bone cancer, brain tumors, pancreatic cancer, or even advanced stages of other cancers that have spread to the bones or other organs. For instance, pancreatic cancer is notorious for causing upper abdominal pain that radiates to the back, often described as a deep, gnawing ache that worsens when lying down. Bone pain associated with cancer often worsens at night, even when you're resting or trying to sleep. Brain tumor headaches may be accompanied by other neurological symptoms like nausea, vomiting, vision changes, blurred vision, double vision, or loss of peripheral vision, seizures, weakness on one side of the body, or changes in personality or cognitive function. Carefully document the patterns of your pain. When does it occur? What makes it better or worse? Are there any associated symptoms? If the pain is new, persistent, and unexplained, or if it persists for more than 2 to 3 weeks despite conservative treatment, such as rest, heat, cold packs, and over-the-counter pain relievers, seek prompt medical attention and request appropriate imaging studies, such as an X-ray, CT scan, or MRI, to identify the underlying cause. Don't tough it out. Investigate it and address it. Persistent cough or hoarseness. A cough that lingers for more than 3 weeks, especially if it's accompanied by blood, even just a small amount. Shortness of breath, chest pain, wheezing or hoarseness, could be an indicator of lung or throat cancer. This is particularly important for smokers or those with a history of exposure to substances like asbestos, radon, or other occupational hazards. It's widely known that approximately 85% of lung cancers are directly linked to smoking. However, it's essential to remember that non-smokers aren't immune. Exposure to radon gas, a naturally occurring radioactive gas, air pollution, secondhand smoke, and genetic factors can also significantly increase the risk. If you're at high risk due to smoking history, occupational exposures, or other risk factors, be proactive and advocate for yourself by requesting a low-dose CT scan of the chest. This imaging technique is more precise than traditional chest X-rays and can detect subtle lung abnormalities and early-stage lung cancers at a point when treatment is more likely to be successful. If you experience persistent hoarseness or a change in your voice, see an ENT specialist otolaryngologist to evaluate your vocal cords and throat. Don't ignore a lingering cough. Get it checked and catch it early. Changes in bowel or bladder habits. Noticeable and persistent changes in your bowel or bladder habits should never be ignored. These can be subtle shifts or more dramatic alterations. Specifically, watch out for pencil, thin stools, which may indicate a narrowing in the colon, blood in the stool, whether it's bright red, dark red, or black and tarry, changes in stool frequency or consistency, persistent diarrhea or constipation, a feeling that you can't completely empty your bowels, increased urgency or frequency of urination, pain or discomfort during urination, or blood in the urine. These symptoms may be indicative of colorectal cancer, bladder cancer, kidney cancer, or prostate cancer. Colorectal cancer is the third most common cancer diagnosed globally. However, early-stage detection dramatically improves the odds of survival, with a 90% or higher survival rate when the cancer is detected and treated in its earliest stages, before it has spread to other parts of the body. The recommended age to begin routine screening for colorectal cancer is 45. Talk to your doctor about the most appropriate screening method for you, which may include a colonoscopy, flexible sigmoidoscopy, stool-based tests, such as the fecal occult blood test or fecal immunochemical test, or a CT colonography. If you experience bladder-related concerns, such as blood in the urine or persistent changes in urination, consult your doctor and request a urinalysis to check for blood, infection, or other abnormalities, as well as imaging studies of the kidneys and bladder. Don't be embarrassed. Be proactive and protect yourself. Skin changes. Beyond the typical moles and freckles that most people have, be vigilant about any new, unusual, or changing skin lesions. Watch for new moles that appear after age 30, moles that change in size, shape, or color, moles with irregular borders or uneven pigmentation, moles that are itchy, painful, or bleed, sores that don't heal, or any unusual skin growths or discolorations. Also, remember that melanoma, the deadliest form of skin cancer, can sometimes appear in unexpected places, such as under the nails, on the soles of the feet, between the toes, or even in the eyes. Make it a priority to have annual skin exams performed by a board-certified dermatologist. A dermatologist has the expertise and specialized tools to thoroughly examine your skin and identify any suspicious lesions. In between dermatology appointments, perform regular self-exams using a full-length mirror and a hand mirror to check all areas of your skin, including your scalp, ears, nails, and soles of your feet. Take photos of your moles to track any changes over time, and use smartphone apps designed to help you monitor your moles and identify potentially concerning features. If you notice any suspicious skin changes, don't delay. Schedule an appointment with your dermatologist for prompt evaluation. Don't take your skin for granted. Protect it and inspect it. Lumps or swellings. Be proactive about checking for any unusual lumps or swellings in your body, particularly in the breasts, testicles, lymph nodes, neck, armpits, groin, or any other soft tissue areas. A new lump or swelling that is persistent, painless, hard, and doesn't move easily when you press on it could potentially be a sign of lymphoma, breast cancer, testicular cancer, or other types of cancer. Additionally, pay attention to any changes in the appearance of your breasts or testicles, such as dimpling, puckering, redness, swelling, nipple discharge, or changes in size or shape. Don't delay. Any new or unusual lump should be promptly evaluated by a medical professional. For women, perform regular breast self-exams at least once a month, ideally 3 to 5 days after your menstrual period, when your breasts are less likely to be swollen or tender. Use a systematic approach, examining your breasts in a circular pattern and paying attention to the entire breast area, including the nipples and underarms. Men, it's equally important to examine your testicles regularly, preferably after a warm bath or shower when the scrotum is relaxed. Gently roll each testicle between your thumb and fingers, feeling for any lumps, bumps, or changes in size or shape. If you discover any suspicious lumps or swellings, schedule an appointment with your healthcare provider for prompt evaluation. Your doctor will perform a physical exam and may order imaging studies, such as an ultrasound, mammogram, or MRI, to further assess the lump or swelling. A biopsy may be necessary to determine the nature of the lump and rule out cancer. Don't ignore a new lump. Investigate it and alleviate your concerns. Difficulty swallowing. Dysphagia. Dysphagia, the sensation of food getting stuck in your throat or having difficulty swallowing, can be an early warning sign of esophageal cancer, throat cancer, or other conditions affecting the esophagus. This difficulty may start with solid foods, such as meat or bread, and gradually progress to softer foods and eventually liquids, as the tumor grows and narrows the esophagus. Other symptoms that may accompany dysphagia include coughing or choking when swallowing, a sensation of food getting stuck in the chest, heartburn, regurgitation, weight loss, and a hoarse voice. If you experience persistent difficulty swallowing, don't dismiss it as just heartburn or indigestion. Seek medical attention to determine the underlying cause. Unintentional weight loss, persistent vomiting, or blood in the vomit, coupled with persistent swallowing issues, should prompt an urgent evaluation by a medical professional, potentially including an endoscopy, a procedure in which a thin, flexible tube with a camera is inserted into the esophagus to visualize the lining. Avoid the temptation to self-treat swallowing difficulties with over-the-counter remedies or dietary changes. Consult your doctor and request a thorough evaluation to determine the cause of your dysphagia. Your doctor may recommend a barium swallow test, an X-ray of the esophagus taken after you drink a barium solution, or an endoscopy to visualize the esophagus and identify any abnormalities, such as tumors, strictures, or inflammation. Don't let swallowing problems persist. Seek answers and find relief. Unexplained bleeding. Blood appearing where it shouldn't be is always a cause for concern and warrants prompt medical attention. The location and nature of the bleeding can provide clues about the potential underlying cause. Examples include postmenopausal bleeding. Any vaginal bleeding after menopause could be a sign of endometrial cancer, cancer of the lining of the uterus. Blood-streaked vomit or coughing up blood may indicate stomach cancer, esophageal cancer, or lung cancer. Blood in the urine could be a sign of bladder cancer or kidney cancer. Blood in the stool, either bright red or dark and tarry, may indicate colorectal cancer or other conditions affecting the digestive tract. Unexplained nosebleeds or bleeding gums, while less common, could potentially be a sign of leukemia or other blood disorders. Keep in mind that even a single episode of rectal bleeding or blood in the urine should be thoroughly investigated by a healthcare professional to rule out serious underlying conditions. If you experience any unexplained bleeding, consult your doctor promptly for a thorough evaluation. The evaluation may include a physical exam, blood tests, urine tests, imaging studies, or endoscopic procedures, depending on the location and nature of the bleeding. For women experiencing unexplained vaginal bleeding, consult your gynecologist for a comprehensive evaluation. This may include a pelvic exam, transvaginal ultrasound, endometrial biopsy, or pap smear to assess the health of the uterus, cervix, and other pelvic organs. Don't ignore unexplained bleeding. Investigate it and address the root cause. Persistent fever or night sweats. Persistent low-grade fevers, around 101°4F or 38, 3°4C, that have no obvious cause, or drenching night sweats that soak your sheets, requiring you to change your pajamas and bedding, especially in the absence of an infection or other identifiable cause, are often linked to lymphoma, leukemia, or other types of cancer that affect the immune system. Cancer-related fevers tend to be cyclical, recurring over a period of days or weeks, and may be accompanied by other symptoms, such as fatigue, weight loss, swollen lymph nodes, or skin rashes. Cancer cells can release substances called pyrogens, which interfere with the body's temperature regulation and trick the brain into thinking the body is too cold. This causes the body temperature to rise, resulting in fever and night sweats, even in the absence of infection. If you're experiencing persistent fever or night sweats, schedule a visit with your doctor for a thorough evaluation. It's helpful to keep a record of your temperature readings and the frequency and severity of your night sweats. Your doctor will perform a physical exam, review your medical history, and order blood tests, such as a complete blood count, CBC, erythrocyte sedimentation rate, ESR, C-reactive protein, CRP, and lactate dehydrogenase, LDH. To assess your overall health, check for signs of infection or inflammation, and evaluate the function of your immune system. A lymph node biopsy may be necessary if you have swollen lymph nodes to determine if cancer is present. Don't brush off persistent fever. Seek answers and protect your health. Knowledge is power. Remember, experiencing these signs doesn't guarantee a cancer diagnosis, but ignoring them or dismissing them as insignificant could lead to delayed detection and treatment, which can significantly impact your chances of successful recovery. Schedule regular cancer screenings as recommended by your doctor or healthcare organizations. Be aware of your family's medical history, as some cancers have a genetic component. Practice healthy lifestyle habits, such as eating a balanced diet, exercising regularly, avoiding tobacco, and limiting alcohol consumption, and always advocate for your health and well-being by being proactive and informed. Your health is your most valuable asset. Take care of it. Keep a detailed symptom journal. Note the date, time, duration, triggers, and severity of any unusual symptoms you experience. Also, record any other relevant information, such as medications you're taking, changes in your diet or activity level, or recent illnesses or infections. This information will be invaluable when discussing your concerns with your doctor and can help them make a more accurate diagnosis. If you learned something new today, smash that like button to show your support. Share this video with your loved ones to spread life-saving awareness and encourage them to be proactive about their health, and subscribe to our channel for more expert-backed health content that empowers you to live a healthier, longer, and more fulfilling life. Together, we can outsmart cancer, promote early detection, and empower ourselves to live our best lives. Be informed, be proactive, be healthy.